There are 1,000,000 ways to die. We just wanna talk about it. Codeheads.
Welcome back, all Codeheads. Here we are.
Good to see everyone. We're gaining some traction.
We are, and we can really only see each other, so thanks. But today we wanted to chat a little bit about the difference between a heart attack, a myocardial infarction, and sudden cardiac arrest. We know that lay people kind of use that term interchangeably, and they are not, in fact, interchangeable.
And indeed, almost invariably, at least every other community CPR class that I teach, people will conflate the two. They think one is the same as
Always.
the other. And that's why it really is a relevant topic, because while it might be obvious to a lot of us, it's not to the lay rescuer.
Yeah, and I think we forget that sometimes because, they'll tell stories and they're like, oh, so-and-so had a heart attack. And I'm like, heart attack? Or they're like, they just dropped. And I'm like, oh, they went into sudden cardiac arrest. Got it. So the treatment's different. What it looks like is different. And just as a little review for all of us is that we know that a heart attack, a myocardial infarction is really, it's a plumbing issue of the heart. So it's really a circulation issue. So there's one or more coronary arteries that get blocked by a blood clot or a plaque buildup from all the fun stuff that we do in life. But it cuts off blood flow and oxygen to parts of the heart, and that causes damage or, death to that part of the heart tissue over time. So that can be minutes, hours, days, etc. Whereas the sudden cardiac arrest or just cardiac arrest is an electrical issue. So the heart's electrical system just malfunctions in some way, and it causes dangerous arrhythmias like VFib, VTAC, etc. And then eventually the heart just stops beating effectively, or it stops entirely. So there's no blood whatsoever pumping to the brain, the lungs, anywhere, and you collapse.
So you mentioned electrical conduction. So we are electric, and it's the electricity, in fact, that does inspire contraction, the actual what enables the perfusion of blood throughout our body.
Correct. And that is really important regarding like the onset and timing of these events, right? So that's why when someone is having a heart attack, a myocardial infarction, it's a gradual buildup, right? Because the symptoms can start, as I said before, days, hours, weeks. People are able to remain conscious and they're able to speak and call for help and say, oh, my chest, or oh, it hurts, or things are feeling weird, because they still have that blood flow. They're still having electricity with conduction. It's just not as good as it could be. So it can take a long while versus cardiac arrest is sudden without warning. And we really don't know. Boom. Yep. We collapse immediately because that electricity is gone. It's like when the power goes out in a hurricane. Boom. Got no power. Can't turn on the TV. Can't turn on that heart. But we know that heart attacks, while they are happening gradually over time, they can eventually lead to arrhythmias and sudden cardiac arrest as well.
Right.
So there can be a little bit of.
Absolutely. They are linked if in fact the arrest is secondary to the myocardial infarction, the heart attack itself. But one very important distinction we should mention, which may be obvious, is if someone's having a heart attack, I'm like this, that quintessential sort of response, you're not going to start CPR on me because I'm still with us. I'm still conscious. I still have a pulse. And that's when we do CPR. Cardiac arrest, like we said, no breathing, no pulse, immediate CPR, regardless of what caused the arrest. So that is the major distinction between the two.
Correct. Heart attacks, you have some time, right? We can call 911 or we can get someone to an emergency room or, wherever we can get them to get some medical attention and get what they need. They're having, as we talked about, women have different symptomologies than men. It can be that chest pain or pressure, the tightness, that left arm pain, the jaw, the neck, extreme exhaustion, etc., shortness of breath. There can be a lot of things that I feel like every single day. But I'm not having a heart attack every day. But that sudden cardiac arrest is that sudden collapse and you are unconscious. So that is the one that is, while they're both emergencies and they're both a big deal, the sudden cardiac arrest is the one that is like the true emergency that we really need to literally jump on, because we need to jump on their chest and get a pulse for them and make a pulse while they're not conducting their own heart rhythms.
Right. And just to say, cardiac arrest obviously can occur because of, I don't know, drowning, like electrocution, a severe blow to the chest during a specific point, commotio cordis. Maybe one day we'll talk about that. Certain drug overdoses, inherited electrical conditions like long QT, all sorts of reasons. Or I get shot in the head. That's a good one. So that would arrest pretty instantly. That's not an electrical conduction issue. Not to be
You're
bad.
not coming back from that.
No, CPR won't help, but do it anyway. Put the pads on, start CPR.
So, we know that time matters, right? So time matters when you're having a heart attack, getting them to a place where they can be reperfused and get rid of those clots or plaque or whatever's stopping their heart or their circulation from flowing appropriately. And then time matters with sudden cardiac arrest too, because as Mike just indicated, our immediate actions on these patients is life or death. So, brain death can start and brain damage can start within moments without blood flow. So the faster we can hop on their chest and at least attempt to get some blood flow and blood to that brain is what is most important. And, starting compressions and using an AED is so crucial. And for both of these, calling 911 really at the initiation improves survival from both events.
Yeah, and with the heart attack, you just spoke of time, and there's the mantra, time is muscle, and that's referring to, trying to save what you can of what's been compromised in the heart.
Yes. And I think it's important to note that survival rates are really high with a heart attack, with a myocardial infarction, as long as we do have those prompt interventions and we get people to where they need to be and get that blood flowing quickly. And with sudden cardiac arrest, the overall survival rates are lower, but that's kind of why we do what we do. And that's why we have this podcast to talk to people and talk with you guys about, the best ways to improve our survivability of these events, because the more people having knowledge and thinking about this every day and jumping on someone to start CPR if they see them down, or at least assess the need for CPR and use of an AED is huge. And that's what we're trying to do, is spread the word and get more bystanders, more people to help and support in times of sudden cardiac arrest. So, a heart attack, just to final reminder, is a heart attack is when the heart's starving for blood, that heart muscle starving for blood, and a cardiac arrest is when the heart stops pumping blood altogether. So when the heart is no longer pumping on its own, that's when we need to jump on the chest and start pumping externally to get that blood flowing. So until next time, Codeheads, keep that CPR going.
There are 1 million ways to die. We just wanna talk